So here's a beautiful article demonstrating the effectiveness of platelet-rich plasma for the treatment of lichen sclerosus. You know, Casabona did some early work looking at lichen sclerosus in women, and then we followed up with our O-Shot procedure, and Casabona used stem cells in his work showing results with lichen sclerosus for women. Then we extended that work and showed that you don't really need the stem cells. Using our O-Shot procedure and our techniques that we've developed with the O-Shot, we could then treat lichen sclerosus in women, and we published that paper without the stem cells. And we published that paper here in the Journal of Academy of Dermatology. You can see it if you go to oshot.info and go to the research section. This is looking, so lichen sclerosus in men and women is very similar in that the woman's anatomy is very much like the man, except that it's smaller, that's all. So here we did not just photographs, we had 2 blinded dermatopathologists documenting results, so you can see, even without being a pathologist, that this has hyperkeratosis. See how much thicker this pink stuff is compared with that? That's the same magnification. And then all these cells here are happy and healthy, where if you look, and this is the after the O-Shot procedure, this is before. You see all this white area, the sclerotic area, and vascular dilatation. That means it's itching, it doesn't work, it hurts, it bleeds, it cracks. This is not a happy woman. And so we showed that and published it in 2 separate journals, in the Journal of American Academy of Dermatology, which is like the New England Journal for Dermatologists. We also published in the Journal of Lower Genital Tract Disease. You can see my name here on the paper. Dr. Goldstein and I worked together on this. And then now we've already been doing it, and thankfully Dr. Casabona now has published this paper showing that it also works for men, which you would expect, but we just went for the women first because it seems to be more prevalent, although the men who have it, it's awful. Now, the only treatment for this is high-dose corticosteroids, but we showed that you can actually stop those corticosteroids, and in the majority of people, both men and women, to get great results. In this study that Casabona did, he showed that in men who are average of 36 years old, they stopped the steroids, which is what should happen because platelet-rich plasma doesn't work well, and then it was not needed to restart it with these men. So this is a major, major, major paper that demonstrates how that there's results. If you want to see more about that, you can go on our Priapus Shot website. If you go to priapusshot.com, and then if you go over to the For Physicians page, then and just click on For Physicians. There's a place there to apply to become one of our providers and to learn our technique. This also can be done by physician extenders if it's approved in your state or your country for a nurse practitioner to do these injections, which most states it is. So just give us this information, we'll send it to you. And I hope you find this helpful. I hope you'll see that many of your patients are helped dramatically with this easy to use, relatively painless procedure because we block it with lidocaine or numbing cream, and it gives great results. So hope you find this helpful.